via www.dovevision.org. That's dovevision.org. And of course, you can like our Facebook page, which is Facebook.com/Dove Television. Once again, I'm Lekon Omoshebi. It's Healthy Living. Remember, Healthy Living is a program designed on Dove Television to simply help you and I to live healthy. And of course, we always bring practitioners here to help us, give us tips and tips on how we can live our daily life healthily. We'll be doing the same this morning. But I think we have a beautiful, fantastic topic this morning, which I think will affect about 95% of our viewers this morning, if not 100%. Well, to help us with the topic this morning, I have with me Pastor Adedotun Ajiboye. I like your name though. Pastor Adedotun Ajiboye is a clinical psychologist. Yes, is a clinical psychologist. So please do not mistake him to be a medical doctor. He is a clinical psychologist from Ekiti State University Teaching Hospital. Ekiti State University Teaching Hospital, Ado Ekiti, in Ekiti State here in Nigeria. Pastor Adedotun, God bless you. Thank you so much for being here. Thank you so much for honoring our invitation and being here on short notice. Really do appreciate it. Okay, now before we get into the program proper, Pastor, just let me quickly ask you this: who is a clinical psychologist?
A clinical psychologist is somebody that has been trained after your first degree.
Okay.
Then you have to go for your master's. Then you must have some experiences in health centers,
okay,
social professional centers, social welfare centers. Then when you have these exposures, then you have a dissertation that now certify you to have masters in clinical psychology.
Okay.
So having first degree does not certify you as a clinical psychologist.
So you really have to get your master's before you could be a clinical psychologist.
Exactly.
Beautiful. So nice to have you here again. Thank you.
Thank you.
Now, for everyone watching at home, we quickly would just like to tell you what the topic is this morning. Now, the topic is overcoming depression. You know, I told you it's a topic that could cut across 95% of our viewers. Overcoming depression. Now, I love the topic. I must quickly tell you. I really do love the topic, but let's start this way. What is depression?
Depression is a common mental health condition that affects our mood, and because our mood is being affected, then it interplays or intervene with our functioning. That's physically, cognitively, and even in your social interaction. Now, when you see somebody have depression, number one is common. As you said, it affects so many people. Then this common illness can affect you in three areas: physically, cognitively, that is in your body; cognitively, that is your perception, your memory.
Perception is how you see things, how you view things.
Okay, your judgment and all that. Then it can affect you also psychologically, the way you think about issues. Okay, for example, now you are anxious about a particular event and things like that. And when this happens, then it will affect your performance. For example, now you may not be interested in doing what you love doing before. It may affect even the way you work. It may affect even you in your workplace. It can affect even your level of output. Maybe you have been producing at the level of 90% before, but if the depression sets in, it can be reduced to 40%.
Okay, please, Pastor, let's take it one after the other. You said, first of all, you said physically. You said physically, how we view things, and then you said psychologically.
Okay.
Now, let's go to physical. How does it affect one physically?
Okay. Physically, I will take it from the body level.
Okay.
Now, when somebody is having depression and it's affecting you physically, number one, you may not even be able to walk faster the way you have been walking faster before, because there's low energy. And at the same time, you may not feel well again, which will turn will affect your body. Okay?
Oh, that's when they say, try and eat something, but I'm not hungry.
They're not interested. And when you don't eat, there's going to be a reduction in your weight, and there can be emaciation, and there will be body weight loss. Okay? Then it can affect you in your cognitively. It can affect you cognitively. That is your perception,
Yes.
the
How
way you
see
perceive things. Then your
Explain that. Explain
okay,
that. How
perception
you-
in the sense that now you see somebody talking somewhere, they are not discussing about you, but something just taught you that no, somebody just told you that no, that discussion is about me. Then you become suspicious. Then, or maybe in the judgment, there's a shout outside the house. Oh, some people are coming after me. That shout is just maybe somebody fell down or a cop fell down. Then you begin to misinterpret situations around you. Then at times also it can affect your memory. When somebody is confused, even though your intellectual capability is intact, but because there's a distortion, then even the normal thing you can remember, you won't be able to remember again. Okay? Then it can affect your reasoning. Now, in a normal situation, you'll be able to make some judgment concerning some situation, but a depressed person may find it difficult to get a clue after that. For example, now if there's inferno in a house, somebody that is depressed may be confused the more. I may not know that he needs to go to the door and open the door and get out of the place. That's cognitively. And psychologically, it can, it can bring up anxiety. You begin to have low self-esteem. That is, you lose your confidence. Even things that you loved doing before, you discover that you don't have the ability to be doing them. Okay, your low self-esteem, your confidence is being affected. Then also it can affect your social interaction. Then it can affect even your libido, your sexual performance.
Whoa.
You may not even want to have anything to do with your wife again. So that's psychologically.
Okay, now let me ask you this. What are the current and basic facts about depression?
One thing that one of them that really shocked me is that presently depression is ranked fourth among causes of disability, and there's a projection in 2020 that depression may rank second among the causes of disability. And when I say disability, it's a compound word. It's not just talking about somebody who doesn't have leg. No, a disability can be a disability as per your performance
You
in your
mentioned
workplace.
some of them earlier.
Yeah,
Yes.
things like that. So now depression is a key issue. It's common. It's not something that maybe is just in a skilled population. It's common, it's everywhere. And that's why our primary health center should take this into consideration. It's not only a mental health practitioner shall put depression into consideration. It's something that is common everywhere. Even in our churches, into society, we should be able to have some tips on how to identify somebody that is depressed and somebody that is not depressed.
All right, now for the sake of those watching at home, I would like to ask a question on behalf of them, which I'm sure they would have loved to ask you. Okay. Although we're going to be taking calls later on in the program, but let me just quickly ask you this. What are the causes of depression? Can a 10-year-old boy be depressed? And what are the causes of depression? Is it hard as you grow that you get to experience depression or you get depressed, or probably right from when you were young?
Okay.
And what are the causes, first of all?
Okay. Based on the literature, there's no actual causes, although there are interplay of biological factors, psychological factors,
Yes,
and social factors responsible
and risk factors.
and responsible for depression. And there are risk factors, and those risk factors are what you and I should put into consideration.
Okay.
And I want to mention them.
Please.
Now, number one is at times it could be genetic. Yes. If maybe your father or your mother have depression, there's possibility for you also to have depression. But I want to explain this.
Wow.
Your family may have that genetic composition, but before you die, you may not have depression if you take precautions, which we are still going to talk about later. Okay? So, because one's father is depressed does not mean that the children will be depressed. It depends on your lifestyle. It depends on the way you think. It depends on your reasoning. And at the same time, if there are major events that happen in your life, because you're already predisposed, then depression may manifest. So, number one thing is genetic factor. That's heredity.
That is closely unbelievable for me.
That's it. We can. It even ranges between 40 to 70% of people that are having depression. It could be hereditary, in a way. Yeah. Then another risk factor is childhood experiences. And for example, if a child is maybe lost both parents at age 2, sexually abused at age 3.
Okay.
Then there's emotional deprivation. The parents are not there. The father comes home once in a month. Or the father comes home once in a week. There's no emotional attachment. You know, the mother also is available, but at the same time, the breast milk is also inside the cup every day. There wasn't a time to cuddle the baby. All those emotional deprivation. Because the baby start learning little by little. You know, that the different stages of cognitive development. Even though the baby cannot talk, you begin to see that some things are not right. Okay, though he cannot verbalize. So when you have either physical deprivation or emotional deprivation, in the later years, it may affect the child. Okay, that's early childhood experiences. Or maybe a child is raised in a house that is always, there's bullying.
Bullying.
Bullying. You know, the child want to talk, the father just sit down. No time to express yourself. Or you have a father that is alcoholic. Is into alcoholism. You know, when somebody have a father is an alcoholic, then that's what when he comes home, there's fire on the mountain. Everybody has to run.
You remind me of a friend I had in primary school that had problems in class because anytime he comes to class, he tells us the father beats the mother. And he experiences that before he comes to school. And so he doesn't listen to
anybody.
Anyone, so even the teachers.
He can beat anybody. And after that beating, he may now be regretting what he has done. And that can lead to depression. Okay? That's number 2, childhood experiences. Then at times also we have what we call personality traits.
Okay.
There are some people that they have this neurotic behavior. They always worry. Warriors.
For no reason.
For no reason. Any small thing, they get worried. So if somebody like that has a major life event, maybe he lost a dear person, then there could be possibility for that person to have depression. Okay? And there are other cases like maybe somebody having anxiety disorders. When you have anxiety disorder, it's like you are anxious about things around you. You don't get a clue on how to solve those problems. And in the process, even for you to think and say, okay, this could be a way out, but because you're already anxious, you may not be able to get out of it. So personality trait also can be a risk factor. And at the same time, when you look at some chronic medical illnesses like diabetes, cancer, all these debilitating illnesses like high blood pressure. Now, when you discover that you have been diagnosed of having any of these medical conditions, then a thought comes to your mind that, oh, could it be that I will not be able to eat this again? I will not be, doctor said I shouldn't eat this again. And this, I'm going to be taking this drug for life. So those thoughts, there's going to be a kind of congestion in your brain. And when you are not able to have a clue outside it, or you don't have anybody to talk you out of that problem, then you will begin to have depression. So there could be a comorbidity between cancer and depression. You are having cancer and you are depressed. You are having high blood pressure and you are depressed.
Okay. Let me ask this. Does depression make one mindedly a stronger person?
Depression make you a stronger person?
Like if you're depressed sometimes, do you want to fight your way out of it? Okay. Does it give you strength? Does it make you a stronger person? For example, one losing his mom, and probably the love between them is pretty close.
Okay.
Obviously, the person will be depressed for a while.
Okay.
But with that incident that made him depressed,
Okay.
still make him a strong person, a stronger person.
Uh,
Can depression help in bringing the best out of
I
someone?
can say yes. Yes, in the sense that if the person
Sees the
help,
other side.
seek help,
Okay.
or is able to undo what is making him to be depressed constructively,
I love that.
or then there are social support or medical health practitioner is able to help the person out of the problem. But depression is there's something in depression we call learned helplessness. That's what we call hopelessness. Now, when you are hopeless, even though you have the thought of hopelessness, when they open the door, a way out of that hopelessness, but because there's a thought of hopelessness already, you are not even seeing the door. You are not seeing the way of escape. That's why when you see somebody that is depressed, all measures, even medically and all that, at times have been done, and the person is still not coming out. But when we want to explain the major and the cause symptoms of depression, I'll be able to also explain better, because being bereaved does not mean that you are depressed. And having a symptom of depression for just 3 days does not mean that you are depressed. So because somebody can be sad, anybody can be sad.
That was there. You took the word out of my mouth. I was going to ask you that.
Anybody can be sad.
Please separate these two words.
Maybe let me
depression,
just,
sadness.
Maybe let me just
separate it from. I was going to ask you that just now.
Okay, let me just explain this. Now there are core symptoms of depression, and there are minor symptoms of depression.
Okay.
The core symptoms are low energy. We just discovered
the core symptoms.
Yeah, the core symptoms. Low energy. You just discover you wake up, you are very weak, tired. 2, you lost interest in pleasurable activities. Maybe you are the type you love praying. You are the type, when they talk about your workplace, you are very happy, but now you are not interested in going to work. You love going to play football. Now you are not interested anymore. Loss of, maybe you like doing household chores, but right now, even you are not interested. A mother that just gave birth to a baby, feed your baby breast milk. No, it's not interested in feeding the baby. Loss of interest in pleasurable activities. That's number 2. Then number 3 is that you have low mood, and that's what we call sadness. Okay. Now, when these 3 occurs, we are not just saying that when they occur for just 1 day, then you are depressed. No, that's not the diagnosis. It has to maybe stay there for almost about 2 weeks before you can say this person is depressed. And there are 3 categories of depression. We have mild depression. We have moderate depressive episode.
The first one is mild.
Mild. And that one, you may not really need to take any drug. Just talking cure by a mental health practitioner can help you out of the problem. What we call, in a layman language, counseling. Or psychotherapy can bring you out of that. Okay? But when somebody is moderately depressed, you may take some medications, maybe when you see your practitioner. And that's why it would be a great advice in this program that our primary healthcare center should know that depression is a common illness. It's not just a mental health condition that should be handled by mental health practitioners. Okay, when you see the cases of depression, refer to people that will treat it, because somebody may have malaria. You may think that the major problem is malaria. It may not be malaria. It could be depression. So now, and the minor symptoms are loss of concentration. Then you are not able to sleep very well. Loss of appetite. Then loss of libido, as I've said earlier. You are not interested in sex. If you are married.
Of course, we're talking about married people.
Married people. Married people.
Just strictly.
Please, we are not talking about people that are not married. Married people. Then you see your wife, you are not interested at all. And at the same time, you just discover that you lost your confidence. You are not. You are the type that you relate well, but you are not interested.
Pastor, looking at our country, and then we look at the economy of this country.
Okay.
And then we look at let's look at the ratio of the people that actually try as much as possible to struggle to eat even once a day.
A day.
So what would you say? I mean, what would you say about Nigerians right now? What level would you say depression is?
I'm sure
As a clinical psychologist
yes,
that you are.
Because of, I'm sure it's getting higher, because if all of us listen to the news, and we know that suicidal cases have increased.
Yes.
Even though we don't have statistics in Nigeria, but you listen to your radio and you hear cases of people
somebody
committing
jumping off third mainland
suicide.
bridge.
And one of the symptoms of depression is when you begin to have suicidal ideation, ideas of self-harm, ideas of killing yourself,
slitting of wrist.
Yes, when you begin to have that thought, that's another symptoms of depression. So now in our present economy, thank God recently, from a few days ago, they said we are coming out
of recession.
They
said we're out.
Okay, we are out. Okay, we are out.
Recession.
But we still want it to be better. Okay, so I think that's a good thing.
That's a good news. Yeah.
But somebody that is already depressed during the recession need to also tell himself cognitively that things will get better. But he may not be able to do that if he's severely depressed, unless somebody help him. Because I said something the other time, that's what we call learned helplessness, hopelessness. You thought that, can I come out of this problem again? So even when they open the way, like they said now, economy has revived, you may not even see any hope in Nigeria anymore. Somebody may just say, there's no need to live again. Let me just die. That's why suicide comes in. And that's why it is a clarion call to the society, to the body of Christ, to individuals, to spouses, to family members, to make sure that we fight this demon, if so to speak, if I want to use it like that.
Yes, it is a demon. Yes.
This debilitating illness that is common on all the places. Because there's no person that is not facing challenges, but the way you handle your challenge matters.
Should one brother in his or her family, or in the offices, or in churches, or anywhere, when you see someone keeping to him or herself often, should one worry? Should we worry about such a person?
Thank you for that question. I think since this is a Christian body,
yes,
and I want to say this categorically. Now, as a pastor, if I see a member that is always coming for digging deep and fake clinic,
very early for workers
meeting, and I discovered that for some weeks it's not forthcoming. Although I shouldn't diagnose, I shouldn't label, I shouldn't say, oh, this guy is depressed. Please, that's not what I'm saying. But it's the responsibility of that leader not to think backsliding. Because if you are not seeing somebody, it could be that person is facing a challenge. And we are triune. You have a spirit, you have a soul, you have a body. Now, if you just take care of the spirit level of your members, and you don't think of the way they are thinking, you don't take into cognizance their thought process, and you are not interested in their head. Even our Jesus is interested in preaching, is interested in teaching, and is interested in healthcare.
We'll get back to exactly where you just stopped right now. Let's just put a peg on it. Okay. All right, viewers, we want to say thank you so much for being there. Hope you enjoy every minute of the program. Remember, in the studio, I have Pastor Adedotun Ajiboye. He's of Ekiti State University Teaching Hospital at Ado Ekiti, and he's a clinical psychologist. And we're looking at the topic, overcoming depression. We'll take a break at this point. I'm Lekon Moshebi. We'll be back.
It keeps getting better and better. Another opportunity to be blessed by divinely inspired programs on the Dove Television channel has just been made available. You can now download the Dove Television application on your Android phones, iPhones, BlackBerry phones, various tablets, and iPads. Just visit the appropriate app store depending on your device to download the application, which enables you to watch programs and listen to the Word of God from anointed men all through the day. Dove Television, on direct-to-home decoder, on free-to-air satellite, on mobile internet TV, and now on mobile apps. Dove Television, taking back the power of the air. Going around the world? And you desire to have unrestricted access to the Word of God through inspiring messages from anointed men of God? Dove Television has now made that achievable. You can now receive the Dove Television channel on the Roku device. The device enables you to watch TV via the internet, not on your laptops or mobile devices alone, but on your television set. Get logged onto the Dove Television channel on the Roku device and be divinely enriched all over you. Signals are available worldwide. Dove Television, taking back the power of the air.
All right, welcome back. It's Healthy Living here on Dove Television. We're broadcasting live from Nigeria. And of course, we still have a pastor with us in the studio, Pastor Adedotun Ajiboye. He's a clinical psychologist, and we're looking into the topic, overcoming depression. Remember, in a few minutes, you'll be able to pick up your phones, and you can call the studio line to ask any question or to contribute to the topic. Pastor, please continue from where you stopped at the time, please.
Okay. And that we should pay attention to the challenges of our people, not with a single eye. We should look at members in our churches, members in our society, as somebody that have a spirit, he has a soul, and he has a body. If I'm always interested in the spiritual level, I'm not interested in what happens to the body. I'm not interested in what happens to the soul. I may lose that person. So it is the responsibility that we, every one of us, even health practitioners, there shouldn't be any segregation. We should work together as a team and handle this depression from an holistic perspective. Even in the church, we should be able to take depression, okay, this person is having this problem. Okay, is there any social support we can do? Is there any problem in the home? What is the relationship between him and the spouse? Is there any major event that happened to him? I shouldn't just think that because he's not coming to church, he has backslidden. No.
I understand.
Because one thing I said about one of the symptoms of depression is that you lost interest in what you love doing.
And what you love doing is coming digging deep, coming for workers meeting early,
so
and then all of a sudden we don't see you in church.
So when you don't see me there, the first thing, nobody should think that that person it could be backsliding, but it may not be.
Even if it's backsliding, like let's just say even if it's backsliding, there's a cost to it.
There's a cost to it. So we should be able to look at things from an holistic perspective and look at our members as somebody that they also have body they carry. So if that body is not, for example, now a pastor that God has given me a revelation, is loaded with inspiration, but is sick, he may not be able to come.
Pastor, are you telling our viewers that there's depression in the church? Is that what you're saying?
If you look at the definition of depression, people in the church are also human beings. They have flesh in their blood. They experience what other people are experiencing. Although they are heaven citizens. But at the same time, the Bible says, I leave them here in the world, but let them be one. Okay? So God still knows that we are still in the world, but we are not of the world. So that suggests the things that are going on in the world, we still experience temptations.
Which I've already mentioned causes of depression earlier on.
Temptations. We go to the same market. Somebody can be bullied. Somebody can be insulted in the workplace.
Can lose a loved one.
Somebody can lose a loved one. Christians can lose their loved ones. So, yes, it's possible, even in the church.
So are you saying depression can be suppressed or slightly overcome by what comes from the pulpit?
Okay, I will not like to use the word suppression because that's going to be another problem.
Okay.
Because when I hear a word from the pulpit and it just suppress my feelings, that suggests that thing that was suppressed after some time
come back up.
If there are some triggers, that's come back up. It's like you put a bowl of water inside a basin, and you look at it from a surface, and you discover that the water is clean. But when you shake the bowl, you just discover, oh, what a dirty water is this water. So now, after message, there's somebody should be able to have you. The Bible says, confess your fault to one another. That's what the Bible says, that you might be healed. So if you keep your fault to yourself and you bottle up emotions, there's going to be a time that that thing will burst. And that's what we call mental health breakdown or mental breakdown. And we said that depression is a mental health condition. So when you are bottling up emotions, for example, now you offended me, I bottled up. Somebody offended me, I bottled up. I go to the workplace, I was offended, I bottled it up. In the church, I bottled it up. In the marketplace, somebody was looking at me as somebody that is not existing. I bottled everything up. Then
you now get home.
Something will now be a precipitating factor. Maybe somebody now came and said, the money I gave to him, he lost it. That will now be a precipitator that will now trigger all those things that have been repressing. They will now come to play and they will manifest as depressive episode. You know, and I said it could be mild, it could be moderate depression, and it could be severe depression.
All right, for those watching at home, I want to say thank you for being part of the program. Now, you can pick up your phones now, and you can dial the numbers on your screen. You can dial the numbers on your screen to be part of the topic for this morning, which is overcoming depression. So if you want to ask any question, or basically you just want to add whatever it is you want to add to the program, whatever contribution you want to make, call the numbers on the screen right now. And of course, you can ask Pastor any question or to contribute. Pastor, let me ask you, there's this question I've had in mind that I really wanted to ask you. How effective are the counseling department in our churches? Concerning the topic for
concerning this topic.
Should the counseling department also notice this in church? Should they also, they just don't leave it to the pastor alone?
Yeah, the counseling department, I think one of the major work is not just to give leaflet to people that gave their life to Christ. It's also a way to help the pastor to sit down with these people. Pastor may not be able to do the work alone. And we should be able to have professionals in the counseling department so that they will be able to attend to people using the skill that God has given to them to help the church.
Because, Pastor, there's a way you could see someone walk into church and you look at the face and you can tell that something is wrong.
Exactly. Exactly. By the virtue of one's profession, you'll be able to discover some things. So I think it should be an encouragement to the body of Christ if we solidify our counseling department.
All right. Good morning.
Good morning.
Yeah. What's your name and where are you calling from?
I'm calling from Benin.
You're calling from Benin. Your name? Esosa. Thank you, Esosa. Please go on.
I'm calling to make inquiries about this depression issue. Would you really know that you have depression? What are the factors that, like the causative agents that causes depression? You know, how do you know that you are depressed? I've already listened to your program. I've seen some signs and symptoms. Is it medically? Can you be able to take drugs and get over it, or should you just rely on the Bible? What is the best way to increase or reduce depression? How best maintain or to treat it?
Okay. Actually, we haven't gotten to that part yet. He was asking how he can overcome depression. We haven't gotten to that part, but Pastor will definitely get to that part pretty soon. But Pastor, you're saying something very important about our counseling department in churches, which like you said, there must be professionals among them.
That's right.
It's not just about giving out leaflets to those that give their lives to Christ. Okay, but we have another caller here. Hello, good morning. Please, sorry, I would like to implore that when you call us, if you're watching me right now and you can hear me, please try to turn down the volume on your television. Bring down the volume on your television to the lowest volume, and then you can communicate with me via your telephone. Please, or you walk away completely from your TV set, please. Okay, now, Pastor, continue.
Okay. As I was saying, that we should be able to strengthen the counseling department of our churches, knowing fully well that depression also could occur among our members. And we should be able to, and there should be confidentiality.
Okay, confidentiality. Hello.
Hello.
Yeah.
morning.
Good morning. Your name and where you are calling from.
I'm calling. My name is Nelson, Brian Nelson from Asaba Delta State.
Okay. Please go ahead.
Yeah, and this topic and the topic we are dealing on this morning is very good. And this one should be one of our cardinal points in our mission. And we believe that while we are dealing with this issue, we should equally go further to ask them their problem, and we should not pay lip service to this issue, because this is one of the issues that can bring men to Christ. This is one of the issues that can bring men to Christ. Deal with the issue, follow it up, and get result out of it. I think this is one issue that is good, that we need to work on as Christians, as a nation. Because many people come to church, if you look at them, you don't know what they carry. After the service, you go home. But when you get close to them, and you deal with this issue of depression, broadening their horizon, and like in the next Sunday you see them, they can even share testimony. But when we just pick them up, we don't get to the root of their problems. We're not there with the issue of depression. Depression is one of those things that, they are even instant killer. They kill easily. But when you take the person out of depression, you see that the person will have long life. Thank you.
God bless you. Thank you so much. I think, what would you like to say to what you just said?
That's a very good, we should not just play lip service. If we say we want to do it, let's do it well. Let's pay attention to that department. As we pay attention to different subgroups in the church, let's also, when you have a subgroup and you don't enable them, they may I'm not talking about money. Let there be people that will be able to help these people in that department. It can be at the area level, maybe, for example, in the Redeemed Christian Church of God. It can be at the parish level, in the area level, in the zonal level. If there's no...
Even at the province. Sorry, Pastor. Hello, good morning.
Good morning.
Yes, what's your name and where are you calling from?
My name is Tolu. I'm calling from Kaduna.
Tolu from Kaduna. Thank you. Tolu, please, go ahead. Go ahead.
Yes, please, I want to ask a question. Can depression be hereditary?
Okay, I'm sure. Okay, all right. Pastor is going to answer now, but I'm sure Pastor has already answered that earlier on.
Yes, depression can be hereditary. It has been confirmed in the literature that it is hereditary. And it ranges between 40 to 70% of people that are having depressive episodes. So that's possible.
That still shocks me.
Yeah.
Seriously, still marvels me. Hello, good morning.
Good morning.
Yes, your name and where are you calling from?
My name is Titi.
Okay. Hello, Titi. Titi, sorry, I have to let you off. I have to let go. Remember, I've said it a couple of times. When you call the studio, please turn down the volume on your TV set. Please do turn down the volume on your television. Hello, good morning.
Hello, good morning.
Yes, your name.
My name is Efe. I'm calling from Sapele, Delta State.
Efe, thank you so much for calling us all the way from Sapele. Thank you.
So please. I have just a question to ask.
Go ahead. Go ahead.
How can we overcome depression?
Okay. We haven't gotten to that part, so I think we should get to that right now. Okay. How do we overcome depression?
Okay. I think the first thing is that you must be able to examine yourself. Even before depression comes, be able to understand what are those things going on around you, within your mind. Now, your ability to examine, Bible says, examine yourself if you are seeing faith. You discover that some things are going on in you. At this time now, it's not severe depression. It's not even moderate depression. When it is, it's still mild depression. You can still understand what is going on. When you identify, then it's your responsibility to take a step. Either you address it by the grace of God, if you get there, there will be a lot of scriptures you can use. Then, or you go and meet somebody that you can confide in. It can be your pastor, it can be somebody around you. And you confide on that person. That's number one.
First step is to identify the cause.
The cause of the problem, or if you have the problem.
Okay. Hello, good morning.
Hello, good morning.
Yes, your name and where you're calling from.
Okay, I'm Temilade calling from Gombe State.
Temilade calling from
Gombe State.
Gombe State. Thank you so much. Please go ahead with your question or contribution.
Actually, the question I want to ask might not be directly related to the question, but it's something close.
Okay.
All right, I got married close to 2 months now, but having sex with the husband has been an issue because I don't really get around, and I end up feeling and all that. When I go to the hospital, they said that it's more psychological, that maybe I've had a bad experience and that, but none of those, because I've not had any of those issues. So I want psychological experience, just down there and all that.
Okay, Temilade, all right. I'm going to rephrase your question now so the pastor will understand what you just said and for everybody else to understand. Now, Temilade from Gombe says that she's married for 2 months, but she's not been in the mood of, having sexual intercourse with her husband. And she's gone to the hospital, and they have actually told her that it's probably psychological. So now she wants to ask you, a clinical psychologist, that what is her problem, and then how can she overcome it? Because probably the husband is starting to complain. Yeah.
Thank God for that question. There are a lot of homes that are broken because one is not able to come out with such issues.
But we thank God for Temilade for opening up. Yeah.
Now, there's a relationship between our mind and our body. The sexual activities is taking place in your body. But if your mind is not settled, the sexual performance won't work. So, and there's a concept in medicine, I don't want to bring big stuff here. We call it psychosomatics. That is, there's a relationship between your psychic and soma is body. So when there's a distortion in your mind based on past experiences or current experiences, there's possibility for your physical activities to be affected. So the advice I will give to my sister is that you should go, if it's in a church, you should go and at least discuss with somebody that will be able to understand. Please, I put that.
Like the pastor.
Okay, at the pastor. Then at the same time, they should be able to refer her to a professional that should be able to help her. And also now she has been to the hospital. And that's why I'm saying that our hospitals should put this into consideration.
Exactly. So they
now,
should refer the right patients
if you say that this person have then you refer her
to the right
place.
Yes.
So she has come to the OPD of that particular hospital. I don't know the hospital, but it's the responsibility of that person she saw there to refer the patient to where she can be treated.
But remember, let me quickly tell our viewers, in case you want to have a one-on-one talk with Pastor here with me, his number will be displayed on the screen, so you can actually call Pastor and have a one-on-one talk with him. His number will be displayed on the screen. We have another caller here. Hello. Hello.
Hello, good morning.
Yes, good morning. Your name and where you're calling from?
My name is Maxwell Oguda. I'm calling from Maryland.
Okay. Maxwell Oguda from Maryland, Lagos, Nigeria. Thank you. Please go ahead.
Okay, sir. I really want to contribute to this topic with the family depression. It's very interesting. And a question I have to ask is, does it automatically mean that if one is moody, he is automatically depressed?
Okay, if one is moody, is the person depressed?
Okay, maybe let me.
Okay, thank you, Pastor.
Let me re-explain again. I've said that
because some people have attitude.
Yes.
Yeah.
I've said that when somebody is moody and it's just one day, yeah, you can be moody if you lost money. You can be sad if you lost money or you lost a dear person. But when that sadness is prolonged more than necessary, it's getting to 2 weeks, then we can say that is depression. But if you are moody just for 3 days, but if it's now becoming an attitude, then you understand, every day they see you, you are not interested in your pleasurable activities again, you are losing interest in what you loved doing before, and you are always sad, even when there's no occasion that should make you to be sad. Then, and it's not just 1 day, 2 days, 3 days, it's getting to about 2 weeks, then one can easily diagnose depression.
All right, now I've been informed that we're out of time. It's a fantastic topic, I must quickly say. But because you have only told us one way to overcome depression,
maybe
give us one more, just one more.
Okay. Another one is exercises. That's an area that we need to really explore. When you exercise, 3 things happen. Now, some chemicals are released into your system, and it helps you in these 3 ways. It helps you to improve your mood. It improves your energy, and it improves your sleeping pattern with this chemical that have been released. And if you know, when I was talking about the symptoms of depression, it lowers your energy, it affects your sleep. So when you exercise, it's like you are trying to improve.
Pastor, I'm being signaled 1,000 times that we're completely out of time. For everyone at home, I'm sure you've enjoyed every bit of today's topic, overcoming depression. I want to say a very big thank you to Pastor Ade Dotun Ajiboye of Ekiti State University Teaching Hospital at Do Ekiti. He's a clinical psychologist. Thank you so much, Pastor. Thank you so much for being here. God bless you. Thank you. Hope when we call you again, you would come. All right. I want to say fantastic thank you to everyone that called into the show. My cameraman, you're awesome. I love you guys. And of course, the control room, thank you so much. And everybody at the MCR, thank you. I'm Lekon Omoshebi. Please stay with Dove Television throughout today for more exciting programs. Till we meet again, stay healthy.